I almost want to say that the most successful carnivore diet a person can be on is the one that they graduate from. Like that you've actually gotten your body to a point where you have healed, and now something like broccoli doesn't hurt you.
Can the carnivore diet give you better health markers? I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional information online. This video was sent to me. It's by Lillie Kane, who is a YouTuber, influencer, and one of the reasons I think it's important to be involved with someone like Lillie is that she's influencing a whole new demographic that never comes to my clinic anyway. My average patient age is about 60 years old, and the average BMI or body mass index is about 35, so that's very high. Normal being under 25, or non-obese being under 30. So when I see someone like this struggling or even just putting out information, it's often I'm reassured, because someone like this is going to be influencing a lot of people. So let's see what Lillie has to say about carnivore being better for her, and wait till the end to hear my final thoughts. Before we get into the video, join me and keto nutritionist Amy Berger for a 7-day START KETO RIGHT challenge starting September 24th. Whether you're starting keto for the first time or getting back on track, in this 7-day immersive challenge, we'll teach you the simplest and most effective way to lose weight. No tracking, weighing, or measuring needed. For just $10, you'll get daily live Zoom sessions with Amy and me, where you'll be able to ask questions and get answers in real time. Not only that, but my team will also be with you inside a private challenge-only Facebook group to make sure you have everything you need when you need it. You're going to be amazed at how much you learn and how much momentum you can build for changing your habits in just 7 days. To learn more or enroll, click the link below. I look forward to seeing you there.
I still can't even believe it. After 3 years of eating a carnivore-ish diet, this is what my cardiac health panel looked like last year. And now for this past year, eating more of an animal-based diet, having more fruits and vegetables, this is what my cardiac health panel looks like. If you're new to the channel, my name's Lillie. I'm a certified nutrition health coach who's on a mission to make the world a healthier place. Now, 4 years ago, I started eating more of a meat-heavy diet, though the first 3 years were more of a carnivore-ish diet. Now, I've always had seasonings, mustard, milk, some berries, maybe some avocados here or there, and just little things. And so it was never a strict carnivore diet by any means, but my diet looked very carnivore to most people. However, one of the biggest problems I've had eating this way is I've developed a very dry, itchy, inflamed dermatitis-like scalp. And this started back when I began eating a lower carb diet and has progressively gotten worse over the years. And so last year, I ended up getting my blood work done. This is what my cardiac health panel looked like in July 2023. And now, frankly, I didn't love seeing this slightly elevated ApoB number last year.
The carnivore health panel is that there was one red box. So if you just look at these panels, anything that's outside the normal range or worrisome is in a red box. So it went from really no red boxes on the carnivore diet, and you're going to see what it changed to. So the main reason that Lillie stopped doing a carnivore diet was this rash. I don't know if it was keto rash. Keto rash is something that's out there, very rare. It doesn't happen. Well, I really have never seen it, maybe once in decades of using it in my office, where I ask people to stay under 20 grams of total carbs. Yes, they are eating 2 cups of leafy greens, 1 cup of a non-starchy vegetable, at least per day. At least that's what I recommend. So keto rash is something that you'll read about and hear anecdotal reports, meaning people will have it, but we don't know the frequency of it, and it may depend on how you do it. or it may be just a matter of time and heals on its own. One case study where someone had the keto rash, went to dermatologists and got treated, it turned out to be some kind of infection that needed to have antibiotic and antifungal treatments. So in her case, it may have been related to the diet, or it may not have been related to the diet. Although I think it went away when she started to reintroduce carbs, which makes you think that it was related to the diet. Let's see what she thinks.
Now, real quick on cholesterol, I've made several videos debunking the myth that elevated cholesterol equates to more heart attacks. This is not true. There's nothing that proves this. In fact, I've interviewed several doctors and healthcare professionals who've debunked this myth. My husband, during his doctorate program, the professors told the students that the elevated cholesterol equals more cardiovascular events is the old teachings, and they no longer teach this.
So I love the people her age, or I assume that's who's watching the demographic here, are hearing this message, because the medical mainstream is very slow to change in their messaging, still worrying and treating cholesterol levels when the cholesterol is not a disease. What we're trying to do is prevent or reverse or prevent the progression of atherosclerosis. That's the disease, not cholesterol.
So between the beef and the butter, I had significantly less saturated fat, and instead opted for more heart-healthy fats, the monounsaturated fats having more olive oil, and then I had less bacon. Yep, I know. Right there, that's probably what made my heart so sad in the first place. And then I had more fruits and more vegetables. Looking back on it, I probably even had less calories as a whole, and so to see my cardiac health panel turn out like this, I'm at a loss for words.
So more red boxes, meaning it's out of the normal range. Well, so she did what the traditional doctors would ask you to do, to lower the saturated fats, to cut the butter, cut the bacon, and it doesn't help. I mean, this is kind of sad that she had to go through this to learn it. And the idea here, though, is how bad is it, really? I mean, how abnormal is it, and does it lead to atherosclerosis? We have to get into that in just a minute.
I'm now going to show a video clip going over my results with Dr. Sabrina Solt, who's more of a carnivore doctor who I ordered these blood work results with, and her reaction, which I thought was very surprising. And then afterwards, I'll share my thoughts and what I plan to do going forward.
The apolipoproteins, these are your transport proteins. So your ApoA1 is going to be more geared towards your transport of your HDL, whereas your ApoB is going to be more geared towards your transport of your LDL. There is this argument that the ApoB is a better indicator of something like a cardiovascular disease process. However, depending on who you listen to, depending on, what lipidologists or cardiovascular specialists you pay attention to, they'll tell you that ApoB isn't even that important if you're under like 35. So I wouldn't take any real stock in this saying that you have an underlying cardiovascular issue, especially given your triglycerides being as low as they are.
So looking at the cholesterol panel, the total and LDL, the old paradigm view, it got worse by adding more carbs, less saturated fat, less bacon. Some people have actually argued that this recommendation to lower saturated fat and to lower the bacon, the butter, that sort of thing, has led to elevated LDLs. She had elevation in her LDL as a result, and total, and didn't really change the triglyceride and HDL. If anything, it went a little backward in terms of the metabolic syndrome way of interpreting blood cholesterol levels. You want the triglyceride to be as low as possible, to be as high as possible. But again, we're looking at the tea leaves, the predictors. A very wise doctor, one of my teachers, said, we measure the blood not because necessarily it means much. We measure the blood because it's convenient, easy to draw. It doesn't really tell you the disease. The disease process we're trying to prevent here, in this case, is atherosclerosis. So the blood levels of the cholesterol panel here, I think, are really not all that important.
Now, this is why I'm not worried about that PLAC, because normally what happens is when we see the MPO go down, we see the PLAC going up as kind of the repair process within it. So the fact that the MPO went down from last time means that anything that was troubling started to repair, and your body's likely utilizing that increased cholesterol that we did see there to start that repair process.
Well, so that is reading a lot of, how should I say, reading a lot into the blood levels to say that that's really what's going on. That's the story we tell. That's the theory that puts the emphasis on measuring these sorts of things in the blood. Why not measure the arteries directly? That's where I've really led to, especially if blood marker looks really terrible, but everything else looks great and the person feels great, measure the arteries to know for sure. I don't know if she's had that done yet.
So this is, again, probably counterintuitive to people that my cholesterol panel went up, even though I ate either less fat or specifically less saturated fat. I've definitely had probably no butter in the past year, and I've had more olive oil.
You know, one of the things that comes to my mind is not just adding in carbs. So you're going to get some inflammation from adding in carbs. But there's also an anti-inflammatory effect of having ketones around. So if you're a carnivore, you're going to be ketone, or you're going to have ketones around. Carnivore is just a subset of a low-carb keto diet where you don't have any vegetable matter and maybe not dairy, depending on the type of carnivore diet you're doing. But so that if she was getting some anti-inflammatory effect from the ketones coming around, helping, because ketones do have an anti-inflammatory effect, you're going to see the increase in inflammation as a result of not having those ketones, and by adding some of the carbohydrates, the vegetables, back. So yeah, this is looking very, very specifically, in my mind, very, very early in a disease process that actually is arterial. You're looking at whether you have atherosclerosis on this artery, and here we're looking at blood levels of things when I'm not sure that she's really developed or going to develop atherosclerosis. So I don't know the right metaphor here, but we're worrying about things that will come and go, and the story is pretty clear that she's telling, but I'm not sure that there's one better way or another based on these pretty, we call them sensitive, based on these very sensitive measures, meaning it might be like feeling the jiggle in an airplane, or a loud noise and you worry about it. No, it's okay. The airplane's still going, but the worry about this kind of detail, I think, may not be necessary.
And I'm like, well, riddle me this, if the cholesterol is the indicator that there's a cardiac damage process happening, and taking the statins is supposed to stop that process, why is the MPO then still elevated? In addition to, of course, the HSCRP, which tells us, is there generalized inflammation happening in the body somewhere? It can be specific to the cardiovascular system, but it could just be generalized. And yours is non-existent.
No.
So that's a really important point the doctor is making, that some of these tests are not specific to inflammation that's happening and leading to damage on the arteries. So if you have inflammation from a skin infection, you have psoriasis or eczema or allergies, it can raise these inflammation markers and not necessarily mean that you're getting atherosclerosis at the same time. So that's a really important point. So it's a non-specific marker of inflammation, meaning it doesn't necessarily specifically mean cardiac inflammation and damage, or arterial, coronary artery damage, which is the artery on the heart.
But if what you're doing feels good to you and your results are speaking for themselves here, I think stick with it. And you can always change. Like, you can always change if new things happen, new data comes in. Like, we can always shift.
Well, and I still eat to most people who would look at what I eat, they'd say I eat a carnivore diet. But to the carnivores, I eat an animal-based diet, where I'd say, I just did a food pyramid video, so it's really fresh in my head. 50% of my calories are coming from ground beef, salmon, sardines, oysters, like animal foods, and then 25% is coming from dairy.
Well, so I love this discussion. This is role modeling a new type of discussion with the doctor, isn't it? Where you're actually talking about food with a doctor, And the idea that you can run your body on carbs or fat, it's your choice, but protein is non-negotiable. You have to have protein to replenish your body's protein. That's what we're made of, protein. So I love that discussion. When you're running your body on fat, it's fatty acids and ketones that you're running on, not just ketones, but that was a great way to say it. And if you're running on, if you're eating carbs, you're running on carbs because you have to burn them first. Remember that we don't store carbs as energy on the body, we store fat. So any extra carbs will be turned into fat. And if you are eating carbs, you have to burn through them. So this is an easy explanation for how low-carb diet, that you don't have to burn through any carbs, starts your body burning its own fat automatically. It looks around, if you have extra fat on your body, you start burning it. And that's why it's known as a weight loss diet, a fat-burning diet. That's why Lillie lost weight using a low-carb or keto type of diet. And now here the choice is, do you go back to, it seems like Lillie misses the bacon and the butter just from her, I don't know, we'll have to ask her. But the idea of a choice here and the change in the blood markers not being so big that will drive what you do, I think is an important one. It's really more a matter of choice here.
I almost want to say that the most successful carnivore diet a person can be on is the one that they graduate from. Like that you've actually gotten your body to a point where you have healed, and now something like broccoli doesn't hurt you. Shouldn't you be in a place where you could handle that if needed? Yes. That's, I think, where we can all agree. So, okay, maybe I might even personally start experimenting with some more things as a graduation. Not to say that carnivore is not useful. I love it. I prefer it. It's easiest for me. But for other people that are out there that may want more variety, or maybe it isn't sustainable for them, or whatever reason it is that they want to graduate from that, I think that should be a thing that makes you successful too, not just this idea of being purist.
And why do you want to graduate? Is it for variety purposes? Is there certain blood markers that you got that you were thinking that you could optimize with some more plants?
I actually just drew some labs yesterday for a couple of things that I was concerned with. So depending on what comes back there, I may have more to say on it, but I actually had some concerning stuff pop up personally with my gum health and some very easy bruising. And people are going to be like, scurvy isn't possible. I'm like, well, if you saw the bruises on my legs and the receding gums that have happened over just the last 8 months, it was concerning. It was concerning enough for me to be like, let me take a deeper look at this because this isn't supposed to happen. Do something for as long as it works. But if it stops working, reevaluate.
Well, that's great advice for anything, isn't it? And what she was describing were possible symptoms of vitamin C deficiency, known as scurvy, which was a classic sort of story of why fruits may be really important, especially if you're traveling a long distance with meats that are processed, and see or never develop scurvy even though they ate off the land and ate animal products. So it's a bit of a puzzle of why someone may develop scurvy. I did a video on this some time ago where there are a couple case studies where people coming to the medical system have documented scurvy with really bad symptoms, and they self-report doing a carnivore type of diet. And what you need to do then is to really kind of follow them around and see what they're truly eating. I remember some years ago, the case studies, someone would say they're doing the Atkins diet, and the doctor would just write in there, they said they were doing the Atkins diet. Well, that doesn't tell you really what they were doing. Someone could be saying they're following Dr. Westman's diet and they're really not. So you always have to know what people are actually having. But if the vitamin C level is low and this doctor's blood and other markers are suggestive of it, it's an easy fix to add in some vitamin C or other sort of food that has it. The interesting thing is that there may have been a special case, perhaps, of the Inuit who lived in the Arctic, and still do live in the Arctic areas where there's no citrus, at least long ago. Now the diet has changed so much and westernized, it's hard to get a true glimpse of what that world was like, I'm afraid. But and that's a vulnerability of a carnivore diet in theory, and the practice of how you do it, I think, is important. So if you're going to do it, there are no good solid papers or clinical trials, prospective trials, measuring everything on a carnivore diet that I'm aware of. So that's why I always say I don't recommend it as a policy until there are published studies that we can go by, and or clinical series of many people collecting their own information. That would be helpful to know. There is a survey that was published of people self-reporting doing a carnivore type of diet, but again, that takes a lot of assumptions of what are people really doing. And to make a real policy with scientific credibility and like a drug would have to be subjected to, that information about carnivore isn't there yet.
So honestly, I'm still very confused on what to do going forward, because if you saw the previous video, I went through the other lab work results other than my cardiac health panel, and you'd see that from going more carnivore to now more animal-based, my kidney and liver function panel improved, my hormone panel improved, some of my thyroid markers improved, my insulin improved, my fasting glucose went down, my cortisol got cut in more than half, some of my electrolyte markers improved, and my scalp has dramatically gotten better. And I'm still uncertain if my scalp has gotten better from just having more iodine, which can be antifungal. I'm not sure if it's from having more vitamin D, which can help with my immune system. I'm not sure if my scalp improved from having more fiber, which can be great for the gut microbiome, or if my scalp improved by having more carbohydrates, which may have helped me with lowering my cortisol, but also overall giving me more hydration, as I might have just been incredibly dehydrated and therefore more dry. I'm not sure. So I kind of feel like I'm in a pickle and I don't know what to do, because it seems overall moving towards more of an animal-based diet did improve a lot of my blood markers and my scalp, but at the same time, you would think you'd want your heart health to be in the most tip-top shape. So I'm not sure what to do.
I'm not too worried about those markers either way. And the very possible problem is the markers aren't the right ones to follow. I know it's tough to say. I'm an internist trained in traditional internal medicine, and cardiology is a subset of internal medicine, and they got off onto this saturated fat, LDL, and reduction of LDL with drug treatment as kind of the only way to do things. Meanwhile, the low-fat diet was one of the only way to tell people how to eat, and that wasn't the right way to do things. Eating fat is fine. The science is solid about that. It's not a marker or a food of concern for heart health. Eating saturated fat is fine. When she said that she would just take a vitamin C supplement and do carnivore as a possible option, or the doctor interviewed said that too, I was reminded of what vegans say, which is, oh, just take a vitamin B12 supplement. So if because the vulnerability of a vegan diet is vitamin B12 deficiency. So if you're going to do that diet, you need to be able to address that vulnerability. If vitamin C is a vulnerability on a carnivore diet and someone likes it, you could just say, well, just take a vitamin C supplement like the vegans just take a B12 supplement. I would rather not have to do either of those things. So what I've been taught and what I teach and publish papers about goes back 150 years. In the clinical setting, goes back now at least 50 years, a low-carb keto diet with just a little bit of vegetables and leafy greens doesn't seem to be fraught with all of these more extreme diets, the problems that they might have. So remember, carnivore is a subtype of a low-carb keto diet. Like the doctor said here, if it stops working for you, or if you're tired of doing that, you can add back a little bit of vegetables and leafy greens and dairy like she has done. And that's actually the method that I've been using now at Duke for over 15 years in the clinic, studying it now for over 24 years. And then we use a method that was used in the clinical programs for 50 years before that. So I think there are a lot of ways to be healthy here, and I don't think Lillie has much to worry about, although I don't think she's measuring the right things. Why not measure the arteries? Of course, you could say the health system isn't paying for it, so you don't want it. Well, it's $150 in my area for one of 2 tests that are readily available. One needs a prescription. One, you can have a company come around and do ultrasounds to look at the arteries. The information in the blood sometimes isn't the most important thing. That's a big lesson here. And then are we dwelling on things that just aren't, that they're too sensitive, so they're really not a signal yet. And then the final kind of internal medicine lesson I can teach you or let you know is that we say, when in doubt, repeat the test. So if you think of it, she took 2 measurements, well, we need a 3rd one. I mean, what if this was just coming there and there? So life is a motion picture, and here we have 2 snapshots. It could be that it was a bad day and that you just repeat the measurements even while eating carbs, and they would have gone back to that initial level. So be careful of just one test. The tests that you get are kind of like the dashboard on your car. There's some of them that are kind of, you don't need to take action now. The windshield wiper fluid is low. Don't have to deal with that at the moment, but if the check engine light goes off, you want to get it looked at right away. At least that's the state of the car that I still drive. So let me know what you think. I hope this is helpful. If you like, subscribe, ring the notification bell. I'm putting out new information on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.